Good evening to everyone present here with us today. This is Shreyan from IGCP, today's moderator. I would like to welcome all the viewers who have joined our platform for better exchange of knowledge that is going to be shared by our keynote speaker, Doctor, for today's session. With much pleasure and honor, let me welcome Dr. Vijay Varath. Sir is MBBS MD consultant allergist, pediatric pulmonologist, a clinical immunologist consultant at Sai Allergy Asthma Eye Hospital. Now, with much pleasure and honor, I would like to welcome Sir again at our forum as he will be discussing on protecting future generation, the impact of tobacco on youth and children. Now, sir, I would like to hand over the session to you for your presentation. Over to you, sir.
Yeah, thank you for the introduction. Thank you, IGCP, for always giving the platform for different topics for the community awareness and for the benefit of the doctors also in their practices. So recently, if you see the chronic respiratory diseases, the cancers, gut problems, they have increased a lot and they're affecting the quality of life of the people. So not only the complications leading to the admissions and deaths also have increased, but as well as even the day-to-day, whatever the people go on coughing, maybe because of the asthma, COPD, many of the people have gut problems and indigestion, constipation, ulcerative colitis, and from there to even sinusitis, then blood pressure, sugar problems. They have already increased a lot. And considering already the pollution has increased so much, the construction dust and vehicular exhaust and all, and the traditional way of using a tobacco in Indian scenario is still very high. That much awareness should have been into the community. And as a no tobacco day today, I would like to share my experiences as well as why the people should take precautions for the next generation, specifically the younger ones and the adolescents. Because now, at our times, never we used to smoke in such a age groups like whatever now the adolescents smoke so much. Even the girls also we see on the streets or near the corners as well as movie theaters and all, they go on smoking. And how it impacts to their health also. And these people are going to be parents in the future, and their children also will have a lot of problems. Tobacco, whatever consumed in India, is one is people have a raw tobacco and add a chuna into that, one type of salt, and they rub it and then they keep it here and they chew that. Many of the people still in the urban slums and the rural areas, they burn the tobacco and they use a misri to clean the teeth in the morning and they keep it here also. Third is a smoking. Smoking is very common. Cigarettes, biddies. Then in the hookahs also, a lot of people put the tobacco also into that and they use as a hookah also. Then previously, many people used to use as a misri, even in the rural areas still, to sneeze and they feel like it gets cleared, the nose and all. They go on using. And then into the pan, people eat, or some of the other additives and all. And what they cause, like tobacco in these different forms, how it impacts to the health of the people. In the smoking form, it is more dangerous. It has been found that it affects the airways, causing a chronic respiratory diseases. Even many of the people have rhinosinusitis or ocular problems. As well as because of that, the inflammation happens and the secondary infections are very common into these people, and then they repeatedly may fall sick. Not only the person who is smoking, even as a passive smoking, the second-hand smoke causes a lot of problem. And specifically like grandparents and all in the rural areas, urban slums, the BD and all, the cigarette, they do it outside and they come home. And they feel they have done it outside, so it will not harm the people. Whatever their wives or their partners, as well as their grandsons, granddaughters, or if the parents smoke outside and come home, exhalation happens for 2 to 3 hours. And whatever the smoke is attached to the clothes and all, that smell also, secondhand smoke also causes a lot of problem to the people which have already allergies or asthma. They get a trigger because of that. Then another form of tobacco, like as I mentioned, Misri, a lot of people they burn it. That smoke travels around many kilometers. Even after people after 2000 meter also, the people have a problem because of that smell and trigger. It is in a very large amount of smoke of the tobacco goes. Then localized forms, as I mentioned, a lot of people have oral cancers, oral ulcers, then throat problems, and this is swallowed that causes to the gut causes inflammation, acidity, indigestion. Many of the people have a habit like they feel that after eating tobacco only, then only they have to go for the defecation. That's a wrong concept, and that addiction happens to them. So such type of forms of tobaccos, they are affecting a lot to the, and specifically this younger generation as the lungs are developing. Even if there are studies done where it has been found that if the parents are at house, if some form of tobacco, and that smell also can cause a infant death syndrome. Even infants can die because of that smell and acute attack of that. And as the children, the younger ones, toddlers, they are developing, the children are always along with the grandparents and age-old practices like burning chulas and all. And if such type of things are there, the lungs, developing lungs will be affected more. And then the younger generation, specifically the adolescents and all, it affects a bad way. As a one term form is the addiction. It's very difficult to remove that addiction amongst that when you go to the alcohol also. Even it has been found like this type of people, the criminal tendencies are more. Then it affects the cognitive behavioral disturbances, irritability, lack of sleep, insomnia, the nicotine content into that. It causes the problems. So in a multiple way, it affects these toddlers and adolescents. Locally also, inhaled form also, the contact one, which causes of oral ulcers and throat problems, and repeated consumption of it will have a long-term chronic respiratory diseases, cancers, lung cancers, oral cancers. And once the parents they have such type of things, the children learn these habits. They also feel that it gives a kick and all. They will learn it early. So it has been found that in the parents or grandparents at house where such type of tobacco use is there, their children are more prone for such type of addictions. And it has a long-term effects to the unborn children. Those mothers or the parents, they go on smoking. It has been found that the fetus has a lot of problems, malformations to underdevelopment or skin problems, respiratory problems in the children are very common. And considering not only to the adolescents or young children which are using such type of or they are having a second-hand smoke, and in a adolescent age group, if they go on doing such type of habits, they continue for that post marriage also, and then during pregnancy, if they go on doing that, it affects the next generation. Even the contact one, as I mentioned, we have seen that a lot of people which go on handling these tobaccos and all, they get a contact dermatitis. Even because we do the allergy tests also for such type of things, and we have found that also the skin problems and all. So the primary immunity also goes down because of that, and the secondary infections happen. So amongst these people which have already the inflammation to the skin or oral airways or throat or lungs and all, and it continues to do that with a continuation process, then the secondary infections happens, and then these children are more prone for severe infections, even the pneumonias and flu or any epidemic comes over there. And in a large way, when so many people go on smoking and using a tobacco, if it affects the indoor pollution also and outdoor pollution also, because it's a combined effect of that. So totally, even when we enter in some room or some of the places like bus stands or railway stations, we can feel that smell of, because many people go on smoking around, and that irritates a lot of things. Like a lot of people have eye irritation, a lot of people have sneezing, sinusitis, a lot of people get a skin irritation, many people get a throat problems. It becomes irritable to them, and even many people have asthma attacks also, COPD attacks because of that. So it's not only a in-house problem; it is a outdoor also. That awareness in India is lacking. Like, what should be the guidelines for that? It should not be open smoke. That's why at least on the airports and all, there are smoking zones. Even if you walk just in front of that smoking zone, that smell irritates you. So our airways gets sensitive to that, and then the hypersensitivity happens, and the inflammation happens, and then the chronic problems. It damages the mucosa, having a IgA deficiency at the local mucosal level, and because of the hypersensitivity, the IgA production also goes on increasing. Some of the patients get a eosinophilic type of varieties, leading to the severe allergic asthma in the late phase of their life. In the childhood one, they are atypical allergies, atopic asthma. They get reversed very easily with the inhalers and all. But these people, which have because of the smoking and all, if they have eosinophilic type of asthma or COPD, then they don't respond that effectively to the inhaler or nebulization. So many of these people requiring a biologics therapies nowadays, like dupilumab, then bendalizumab and all. So the cost of therapy, these are very costly medications. The cost of therapy increases a lot. In Pune like city, we have seen that 40 to 50,000 of the people indoor above 50, 45, which are requiring oxygen at home because of the COPD. And pollution is one of the things. Along with that, such type of smoking habits, they add on the effects in these people. They have more these chronic respiratory diseases. And when there is a difficult to control the asthma or COPD, then it affects the heart also. So even it has been found that the severe asthmatics, 30% of them have cardiac complications. Again, these COPD people, a lot of them, when they get a one-sided more inflammation, they get a pneumonia because of the quality of life is affected, their breathlessness, they can't do the much effort work, the play is affected, they can't enjoy the life, the quality of life becomes very difficult for these. So in the childhood, if this type of habits are there into the children or adolescents, their lungs are developing and they will be more prone. Like previously, we used to see these conditions at the age of 65, 85. Now we are seeing at the age of 22, 37 with the COPD. So because of these exposures and all, that awareness should be to the community that. So the people which are smoking, they are not hazarding themselves, but even they are hazarding to the secondhand smoke to their children, their partners, their brothers, at their houses. If the parents are not smoking and the person is smoking, it will affect the parents also. And then even because of this chronic respiratory in India, what happens with the people till they have severe attacks, they don't bother. So even after climbing 6 to 7 steps, because we do a lot of spirometry camps, then we found that many of the people when we did the spirometry, they had a changes. But from their point of view, when we explained the reports of the spirometry, they said, okay, yes, sir, nowadays after 6 to 7 climbing stairs, or after doing some exertion, we feel breathless and all. So they don't bother about that. But that is a poor quality of life. It goes on continuing. So if you make an awareness amongst that into the community that the tobacco is very bad for health and not only just respiratory, even it leads to the cancers, even the oral cancers, and skin is affected. Each and every part of the body also can be affected because of that. Gut problems and all, leading to the GI troubles and all. And a simple precaution, avoiding these things. And many people, they will say, hey, we can't escape that. So there are de-addiction programs also. And even exercise is one of the best one to stimulate the nicotine. If the people do the good exercise, any form of good hobbies, the endorphins are secreted. So they will act like a nicotine only. So rather than having such type of things, if they opt for such type of exercises, singing, dancing, or something, it will be really helpful to their health also, and to their own children, their families, and the long-term complications. And considering all these immediate effects and long-term effects, awareness into the community is important. And even at three levels, at the house level, at the community level, and at the political level, the officers, they should have some guidelines like Western countries. There should be the areas if the people want to smoke rather than in the open areas, because the passive smoke is also dangerous to the community. So that way, that awareness should be brought into the India. And specifically these younger generations, they affect very badly. So not only the physical one, as I mentioned, into the adolescents, the brain gets affected because of that. The addiction happens, the cognitive behavioral disturbances, insomnia. These problems have been found in a very big way. It affects the gut also, so the loss of appetite happens in the children. So their nutrition is affected. So the long term wise, it will be very bad for their health. That way. So we have to make awareness repeatedly, and the community should be made aware that tobacco has to be banned at every places, and the awareness should start from home to the community to the political level also, so that the long term wise it will have a very good impact to the at a different levels basically. And it is a not a just localized problem or just a individual. Like the people feel okay, like I'm smoking, so why should you bother about that? But it does not. It is harming to the other people also, as I mentioned, into the family, the close relatives, and all. And the long term wise, but simultaneously the people smoking into the community level also, it has a impacts on that, and it affects the genes also, genetic. It has been found that the grandparents or parents which have done all these type of things, the next generation has a different type of disabilities and the chronic inflammatory conditions, and leading to the even a lot of disabilities to the next generations. It has been found. So genetically also it affects for a longer and for the next generations also. That way. Thank you. Thanks a lot. If any questions, so we'll go for that.
Thank you so much, sir, for this wonderful presentation and discussion. We do have some question if you'd like to take that up.
Yes, please. Yeah.
So, sir, the first question is, how does early exposure of tobacco product affect the long-term health of children and teenagers?
Very good question. Actually, as I mentioned, even the pregnant mothers or the girls before the pregnancy, adolescent girls, if they go on smoking and all, it impacts their health on the uterus also. Even it affects the infertility, and even such type of mothers, if they go on smoking or even alcohol also, they affect the fetus. So the fetal intrauterine also, when the fetus is there, it gets affected. And from there to the infancy, when the child is developing, if the parents as a second-hand smoke also, the child is affected. In the toddler also it is affected, and adolescents by this passive, and in the active smoking also it affects. So at all ages, even when the child is in the uterus, in the infantile or in the fetal stages also, it affects the children.
Next up, sir, we have how does advertising and marketing influence children perception and use of tobacco?
Definitely, because see, people feel like looking at some Bollywood heroes, or yeah, they feel like that is uh, a prestigious thing, or people appreciate that, so they follow that. So that should not happen. Actually, this advertising makes a lot of. So it should be banned. Actually, advertising should not be there.
So, one last question.
Yes.
What policies and regulations are most effective in reducing youth access to tobacco production?
Actually, most important is when the demand is there, the supply is there. So once the people will start not to use it, definitely the supply will not there. Otherwise, the taxations and all, there are so many taxations. The government is also getting a benefit of that. So it's very difficult. It's everywhere in the world. There are a lot of things happening. So the people has to take an initiative. They should stop using it. Then automatically the production also will come down.
Thank you so much, sir, for answering all our questions. That's all from our audience. Before concluding, sir, any take-home message?
Definitely, as I mentioned, it's a community problem. It always starts from here. So once we start thinking it's not good for the health, for us also, for our children, our family, the community, everybody should think on that. Then only the difference happens. So each and everybody should think on that, and at all levels, at the individual, at the community, at the political level, there has to be the some things, so that only it will have beneficial to the generations. Thank you.
Thank you so much, sir, for joining us today. It's our pleasure to have you here, sir. Thank you.